Dr. Jason Loth with Nevi Health, and today I'm going to talk to you a little bit about what a chiropractic adjustment is and why does someone need a chiropractic adjustment. So first off, just to educate you on what happens within the spine and specifically the joints of the body. So over time what will happen is people will develop wear and tear stresses, bad postures, poor sleeping positions, different work positions on a computer. Many of those things can lead to wear and tear. There's also things such as car accidents, sports injuries, major falls, massive traumas, or they call those macro traumas, that can lead to scar tissue or dysfunction within joints. So what happens is when you develop that scar tissue within the joint, that restriction inhibits mobility within not only the spinal joints but other extremity joints of the body. So what that kind of looks like is this, just on a hand model. When I check the mobility of the joint to see how it's moving, the joint should have a good give to it, or good motion. And what happens is when you develop scar tissue within that, it lays down haphazardly over the joint and it inhibits your mobility within that joint. So the ultimate goal for the adjustment chiropractically is to actually break free some of that scar tissue and actually restore normal mobility and motion to that joint. Now, when you have lack of motion in the joint, what happens is you create further muscle tightness, you put stress on the discs, on the nerves, and many other problems. The problem is when the neurological system's affected, it can cause a multitude of other conditions that can come down the line, and I'll talk a little bit more about that here in just a couple minutes. But let me show you a little picture here of scar tissue. If you can look at this model right through here, here's what happens. There's scar tissue formation in the backside joint complex within the spine. Now over time, that restriction leads to a couple things. Extra wear and tear stress on the discs, and as you can see here, this leads to what's called degenerative disc disease. That's degradation of the disc and actually spurring and calcific buildup around the bones of the spine. Here's a normal healthy disc, and here's an abnormal disc. So as time goes by, arthritis can come from this restriction in there, one means of arthritis. Now the other thing within this, if you look at the scar tissue here, that's what I was talking about earlier about what we free up. Now as that develops, this little light blue section here is where the nerve comes out. As you can see, the one down here, there's not much room for that nerve to come out. Therefore it compromises its function. And when you compromise the neurological function, you can affect many other problems within that. So just to show you a brief presentation of kind of how that looks on this view over here, here are actual x-rays representing that. So as you can see over here, this is a picture of your neck. It's got a good curvature to it, and it's got really good spacing where the discs sit, and the joints look really clean and crisp in there. That's a normal picture of a neck x-ray. What happens is your dysfunction sets in there and that scar tissue's in there. Your spine will start to straighten out over time, the space will get smaller in here, and then it'll lead to bone spurring and even smaller spacing where that disc sits. And then in time, it wants to try to fuse itself. That's the progression of arthritis or degenerative disc disease, and that will happen with joints that don't function normally. So that's the main purpose of a chiropractic adjustment. Now, just to add to what we talked about a little earlier, come look at this model here. When the nervous system's affected by that last complex that I just showed you, all of these areas can be compromised. So if you look through here, you can just read some of these. The base of the skull, eyes, nose, sinuses, mouth, tonsils, neck muscles, shoulder, wrist, esophagus, heart, liver, diaphragm, stomach, pancreas, spleen, kidneys. That being said, pretty much every organ system or everything in the body can be compromised because it is innervated by the nervous system. So over time, that wear and tear wear and tear stress on the spine or any other joint leads to that scar tissue. And if that scar tissue doesn't get removed and it starts functioning better, your body could go down this path. Now, just a couple experiences that I've had personally with patients. When I've adjusted patients, I've had people that have had their sinuses drain immediately. Not to say that that happens with everybody, but I know there can be an impact neurologically from the adjustments of the spine to all these things. I've also had people that have had digestive issues that have cleared up just with chiropractic alone. I've also had headaches go away instantaneously after adjusting people, among pains and many other things. Again, there are multiple causes to all these different conditions, but one of the main causes that we look at and get rid of is the neurological and the joint functional side of things. So when it comes to chiropractic adjustments, that's one thing that we do here at Nevi Health that could help. What I would recommend is look through the rest of our videos to see specific adjustments of some of our doctors performing them, to see kind of how we do that and the other techniques that we use to accomplish these adjustments. Here at Nevi Health, we have a multitude of different techniques that we use to help each individually and fit their needs to accomplish the goal of restoring their health through this adjustment and chiropractic care.